6:02, we begin with the latest on coronavirus concerns as we track the latest on the global impact of the illness. We begin with Wall Street. The Dow dropped nearly 1,200 points yesterday, the biggest single-day drop in its history, and investors are now bracing for what is the market's worst week since the 2008 financial crisis.
Overnight, it was announced Disneyland Tokyo shutting down until at least March 15th over fears of the virus spreading. Disney parks in Shanghai and Hong Kong have already been closed for a couple of weeks.
And today, Congress is going to receive another briefing on the outbreak from the Trump administration.
It comes as works on funding now for a bill by the federal government in response to this virus. Kate Walsh live in studio this morning with more.
Well, there's still no vaccine in the near future or really any medicine to prevent the spread, but new in the last 24 hours, the Centers for Disease Control has updated its guidelines for testing patients for coronavirus. Now it will include anyone who is showing symptoms of fever and respiratory problems and no known source of exposure. Those people will be getting tested. This comes after a patient in California contracted the virus with no known direct relation to any international travel. But that new patient got it from someone else in the country who likely had contact with other people. Another concern, a government whistleblower claims U.S. health workers didn't have proper training or protective gear when dealing with people in quarantine. But President Donald Trump said efforts to contain the virus are working.
We have done an incredible job. We're going to continue. It's going to disappear. One day it's like a miracle. It will disappear.
The fear of the unknown surrounding this virus isn't just affecting stock markets, but stock of masks. The CDC Director Robert Redfield is advising people not to buy them.
We need to make sure those N95 masks are available for the doctors and nurses.
New in the next half hour, we will hear from a disease forecaster out of Boston about the trends he's seeing when it comes to the coronavirus, especially here in New England. Live in the studio, I'm Kate Walsh, Eyewitness News.
Of course, stay with Eyewitness News for continuing coverage of the coronavirus concern. We'll have details on air in every newscast. You can also get the latest headlines and updated numbers of people with the virus on WPRI.com and the WPRI 12 News app. And it's now the coronavirus. More and more people around the world are getting sick. Latest numbers show more than 83,000 people are now infected. That includes 570 new cases just today in South Korea.
And this morning, we're learning more about how the virus could potentially spread if it were to make its way into New England. Kate Walsh is live in studio with the details.
Well, health experts from the Centers for Disease Control are all in agreement. It's not a matter of if this virus will spread within communities here in the U.S., but when. And the when is the very business of Dr. Alessandro Vespignani. He's a disease forecaster out of Northeastern University in Boston. Mapping technology with these flashing lights you see there predicts the spread of the disease. He uses an algorithm looking at travel data and travel habits of people across the country and around the world. Based on that, he predicts more cases in Boston in the next 2 weeks to a month.
The next few weeks is a crucial time. We have a lot of visitors, we have a lot of students. It's important to be ready, not to panic.
Boston health leaders held a news conference saying they're currently monitoring 34 people for potential exposure to coronavirus, but none of them are showing symptoms. And here in Rhode Island, health workers announced yesterday 26 people have been voluntarily quarantining themselves since traveling to China, and all but 3 have now been cleared of that 14-day quarantine period. Live in the studio, I'm Kate Walsh, Eyewitness News.